Here's the thing that we need when we were getting infant vital sign. The first one is the alcohol to sanitize our hands. We have the digital thermometer, tape measure, the weighing scale, and lastly, we have the stethoscope. When assessing an infant vital signs, you want to stand with the most non-invasive vital signs first while the infant is calm and resting. First, we're going to check the respiration, the heart rate, the temperature, weight, length, head and conferences, and the chest size. Before you assess infant vital signs, you need to make sure you gather all the supply. You're going to use the stethoscope, the tape measure, the thermometer, and the weighing scale. And lastly, you need to use your watch. Make sure that you sanitize everything that you are going to use on the infant before and after use. Checking the respirations. To count the respiration, we're going to count 1 full minute, the rise and the fall of the chest. We're looking at the rise and the fall of the chest. You could lightly place your hand on the chest to feel the rise and fall. Her normal respiration is 38, which is normal because the normal respiration rate is 30 to 60 breaths per minute. In checking the heart rate, make sure that you are using the appropriate size diaphragm and meds so you were using an infant size. For infant less than a month, the normal infant heart rate is 100 to 190 beats per minute. And if the infant is over 1 month, the heart rate beat goes down a little bit. The normal ranges is about 90 to 180 beats per minute. Now, we're going to find the apical pulse. We're going to find the fourth intercostal space and find the clavicle. Then we have the breastbone. Now, we're going to place that stethoscope in at least 1 full minute. Infant heart rate is about 142. Checking the temperature. Using the alcohol and the cotton balls, we're going to clean the thermometer before using it. To check the temperature of the infant, you're going to check it by axillary rone. We're going to place the thermometer in the armpit. The temperature in the infant can vary anywhere between 99.5 to 99.3 degrees Fahrenheit. To check the temperature, make sure to turn on the thermometer and place the tip of the thermometer deep inside the armpit. Wait for the thermometer to beep. The thermometer is beeping and it's done. The reading is 99.1. These fall in the normal range. Checking the infant weight. To obtain weight on an infant, you need to remove the infant's clothing and soiled diaper, and a dry diaper can be used. Place the infant on the scale and obtain the weight. Consider this infant weight is about 10 pounds and 2 ounces. So you need to document that and look at the infant's previous weight. Measuring length. To measure the length of an infant, you need tape measure and pen. Leave the baby on the surface that you can mark. You need bend for this and measure the baby from head to heel. Put their midline like this and then just mark their head, then make the leg and extended it outward. Make sure it's nice and extended. Mark it at the heel. A normal length for an infant is 18 to 22 inches. Now, we're going to lift the baby up so we can check it by using the measuring tape. We're actually measuring it in inches and the infant is 22 inches. Measuring head circumference. Measuring head circumference. You're going to need measuring tape and measure it in centimeters. A normal head circumference in an infant is about 33 to 38 centimeters. Now, we're going to place the tape measure around the largest diameter of the head. To do that, we're going to place a little above the eyebrows, and then we're going to place it to the most prominent part of the back of the head. Gently lift the head off and put the measuring tape behind it, and then fold the measuring tape around and let's see what we get. And his head circumference is about 37 centimeters. Measuring chest circumference. Measuring chest circumference, you need the measuring tape again, and you'll be measuring it in centimeters. Use the nipple line as your guide. Rub it around and measure it, and it's about 36. 36, it should be 1 to 2 centimeters less what the head circumference was.